The headlines, the issues impacting you, all on This Week in Cincinnati on 9 on Your Side.
Welcome back. Now on This Week in Cincinnati, repealing the Affordable Care Act and caring for those with mental health and substance abuse disorders. There is a lot we don't know right now about the system that will ultimately possibly replace Obamacare and how the transition from Obamacare to a new system will indeed work. It is estimated that about 500,000 people in Ohio alone receive care for mental health needs through the Affordable Care Act. Joining us now to talk about all of this, we have Joan, Executive Director of the Mental Health and Addiction Advocacy Coalition, and Sandi Kuehn, President and CEO of the Center for Addiction Treatment. Also with us here, Lisa Bernard-Kuhn, who covers these issues on WCPO.com. Thank you so much for joining us. There is so much uncertainty with this. Obviously, the campaign and the administration really stood for repeal and replace. Then some new terms started coming out of the administration where, well, it's going to be kind of more of a patchwork. We are going to keep certain things from Obamacare. When you start hearing how this is playing out, what are your first concerns from both the mental health and substance abuse treatment?
So one of the things we know is that because of the ACA, we're talking about a population of folks that have historically had, folks with mental illness and substance use disorders have historically had difficulty, disproportionate difficulty, obtaining coverage and access to services. Mm-hmm. The ACA was a game changer. Because of the ACA, in the state of Ohio, we know we have about 230,000 folks who have been able to obtain health care coverage now because of the marketplace, and about 700,000 that have been able to obtain coverage through the Medicaid expansion. The concern is that if you repeal that without a replacement and without an adequate replacement, you're pulling out the rug from 1 million people in the state of Ohio that now have access to health care that didn't before. Mm-hmm. And they're getting mental health care and substance use care and kidney care and diabetes care. We don't want to see the rug pulled out from them.
True. With CAT's population, we do adult treatment. Right. Before the expansion, Medicaid expansion, about 10% maybe of our patients were Medicaid eligible. Now it's closer to 30%. And what that does, though, is not only allows them to get treatment at CAT or anywhere else, but it opens the door to primary health care too. Many of the patients who are active in their addiction are not taking care of the other physical pieces of their health, and being able to enter into another kind of an arrangement with a care provider really helps to get them more steady. Mm-hmm. A lot of times it reduces the trigger for going back out and for relapsing.
Being able to get treatment, these folks have been able to get their lives to I don't want to offend anybody, back to a normal standard to be able to re-enter the workforce and education and get their life on a positive track.
Correct.
So if you yank that out from underneath them, they're just going backwards.
That's exactly right. And the reporting is showing they're saying exactly that a large percentage are saying it's allowed us to remain at work, to get work if they don't currently have it. Mm-hmm. We're also seeing they're not using the emergency room to the extent that they were before. We're seeing medical debt for these folks fall by half. So it's had significant implications for these folks, all of which have been positive for not only that individual and their family, but for the communities and frankly for the state of Ohio.
Now, Lisa, obviously you've covered many aspects on this on WCPO.com. What are you seeing in your coverage as the first 2 weeks of the administration are now in place?
Well, to back up just a bit, one thing that really stands out about this is when you think about this population, mm-hmm. individuals who have struggled with addiction or mental health, before the Affordable Care Act, this was an area often not covered by insurance. So, as it was already sort of asserted to, these were individuals who were struggling for many, many years with what medical professionals now say is a chronic health condition that should be treated just like diabetes or like, cardiac problems, that you should be able to walk into a healthcare system and get a full spectrum of services for your addiction or your mental health disorder. And increasingly, as funding has been made available through the Affordable Care Act, mm-hmm. health systems have been putting programs into place. And as you see, programs have been bolstered at some areas that are providing these services.
So what would you encourage folks to do out there right now? Pick up the phone, write letters, and what are your teams doing to try to get some of the ACA to stay put that really helps folks?
Joan is probably more on that end, working with the politicians and making sure that they're at least aware mm-hmm. of the challenge that our population will have if it doesn't cover our people.
So we're working with local stakeholders and also stakeholders around the state and frankly around the country to try and get the message out about the importance of this coverage for people and their families and their lives and for our state. We can provide services on the front end, or we can provide services on the back end. They're a lot cheaper and a lot more effective on the front end if we can get people into care than providing services in emergency rooms and other more costly ways. That's the message we're trying to get out.
Okay. All right. Joan England and Sandi Kuehn, thank you so much for joining us. I know this is a very broad topic. We'll continue to monitor and follow it week by week as these new announcements come out. Hopefully you'll come back and talk a little bit more about them. And of course, you can go to WCPO.com as well and see Lisa's latest articles on this issue and many other topics. Thank you.